Myth or fact? Adrenal fatigue is not real.
Well, that is definitely a myth. Hi, I'm Dr. Sakina Davis with Woodlands Wellness and Cosmetic Center, and I specialize in treating adrenal fatigue. So, a lot of people think that adrenal fatigue is a made up diagnosis, and it actually is very important that we discuss stress and how it affects our hormones. So, let's go back and use our common sense a little bit. I think, unfortunately, sometimes in medical school, we have sort of given the process of common sense thinking away. And so it's important that we realize that stress affects our body in so many different ways. And we produce stress hormones. And one of the major stress hormones that we produce is called cortisol. So when we measure your cortisol levels, we're checking to see how your stress is affecting an organ in the brain called the hypothalamus, which affects the pituitary gland, which affects the adrenal gland. That's called the HPA axis. That stress makes a huge impact on the production of cortisol. And when your production of cortisol is very, very, very high under a lot of stress, you're going to notice that you're going to start to gain some weight, especially around the belly, and just not feel good, feel tired. But what's worse is if we don't address that and we get to the point where your cortisol production is very low, then we find that you're completely exhausted, can't get out of bed, can't function, can't think. So, adrenal fatigue is not a made up diagnosis. It's addressing how stress is affecting your hormone production. So, come see us, and we can help address this with supplements, with mind body technique, and with medications if necessary.